Today's talk is on nasal subunits. We're going to look at the different subunits and how they help us to plan nasal surgery. So I'm going to refer to Rod Rohrich, Nasal Reconstructive Nuances. He's done thousands of cases, and so he's one of the best people we could learn from. Well, in rhinoplasty, we try to conserve as much tissue as possible these days. We're not aggressive at all. In fact, just the exact opposite. We are minimalist in our approach. And when you think of the nasal subunits, they're just for reference because you're not going to use these subunits to reconstruct that area of the nose using a subunit. It's not going to be possible. So if you had a defect, say, you have 1 here, the dorsum, 2, the laterals, 3, the tip, 4, the alar regions, 5, and the columella, 6. So when you reconstruct a large defect of the nose, say in a BCC or trauma, you'd have to reconstruct the defect and not the subunit as such. So later on, you could defat your flap, or you could make it look better by trimming it or using microdermabrasion or lasers. But overall, you'd have to fix the defect and make sure that you're not providing another defect for the patient by using a sloppily designed flap. And we prefer the use of an actual pattern flap. For instance, we use the forehead, which is tailored by our unit, modified so that there is no need of a skin graft on the forehead. So that's the tailored flap that we designed here. And as an aesthetic craniofacial group, our aesthetic endpoint then would be a good looking nose, a good contour, both from the frontal view and the lateral. So that's about the aesthetic endpoint and the subunits.